My guest is a dedicated advocate working at the intersection of rare diseases and health equity. She founded the first young adult bleeding disorders initiative in the U.S., expanding youth representation in legislative advocacy and policy discussions. She joins us on this episode to share her journey. You're listening to the PHEC podcast, episode 419. The field of public health is so broad, overlapping multiple industries. With epidemiology at the core of public health, there are an unlimited number of ways to target specific populations, health conditions, environmental issues, and causes that matter most to you. My name is Dr. Huntley, and I'm the host here on the Public Health Epidemiology Conversations podcast. I'm an epidemiologist, consultant, and entrepreneur with over 20 years of experience in healthcare and public health. On this podcast, my guests and I engage in conversations that demonstrate the importance of public health and epidemiology across a variety of industries, helping you think outside the box and inspire greater positive impact in communities around the world. Now, let's dive into the topic of this brand new episode. Greetings, everyone, and thank you for joining me on this episode. My name is Dr. Charlotte Huntley, and I lead an epidemiology consulting firm that supports large nonprofit organizations and community health foundations. We specialize in a variety of community assessments, helping our clients communicate their health information in plain language to their community partners, as well as the broader communities they serve. The support that we provide often falls in the category of strategic planning and sometimes capacity building. Please reach out to us through our website, drchuntley.com. We'd be happy to meet with you and explore how we might be able to support your organization. The links for our website will be provided in the show notes as well. I am excited to introduce you to my guest on this episode. Let me formally introduce her, and then I'll connect our conversation. Shanthi Hegde is a dedicated advocate working at the intersection of rare diseases and health equity. Living with two bleeding disorders and immune dysregulatory syndrome, she brings an intersectional lens to her work. Shanthi currently serves on the board of the Hemophilia Federation of America and has previously served on the board of the National Bleeding Disorders Foundation. Her national advocacy efforts span multiple fronts: advancing mental health access for individuals with rare disease through the Bleeding Disorders Substance Use and Mental Health Coalition, pushing for affordable drug pricing, championing education and research initiatives for women of color with bleeding disorders, and consulting. Shanthi founded the first young adult bleeding disorders initiative in the U.S., expanding youth representation in legislative advocacy and policy discussions. In fall of 2024, she led the inaugural Youth Adult Summit in partnership with Sanofi, creating a platform for education and advocacy surrounding rare diseases. Additionally, she consults with both pharmaceutical and nonprofit sectors to strengthen patient advocacy programs and provide equitable drug development. Her research interests include improving access to mental health care and examining the impact of medical traumatic stress on individuals living with rare and chronic diseases. Shanthi is currently pursuing a Master of Public Health at Brown University. She holds a Bachelor of Science with honors in psychology and biology with a minor in history from Northeastern University. Let's connect my conversation with Shanthi right now. Well, I'm excited for you all to meet our guest on this episode today. Shanthi, welcome to the podcast. How are you?
So much for having me, Dr. Huntley. I'm good. How are you?
I am doing well. You and I had the opportunity to meet and engage quite a bit at the American Public Health Association's Policy Action Institute in DC, but just early last month or about a month ago now.
Yeah, about a month ago. Yeah, time flies when you're having fun.
That's right. I was served as a moderator, and you were on a very unique panel this time around. They had a group of speakers and decided to have you all do a sort of a TED Talk for a bit, and then we sat down and I hosted a round of questions. And I was so moved by what you shared. Really, all of the speakers on that panel, I immediately, it's like, I need you all on this podcast. And you did not hesitate. You were like quick to get on the calendar. And I was so excited about that. So
Thank you so much for having me. And of course, I loved having you as a moderator, first off, and I love your work. So I was very excited to just chat with you more.
oh, that's very sweet. It was a really nice setting because we had the opportunity to engage actually for the couple of days. We were at the same table between speaker sessions and shared meals and conversations. So it was really, really nice. Thank you for taking some time and coming to chat with our audience. So let's start by you just introducing yourself. Tell everyone a little bit about who you are and what you do.
Yeah. So, hi, everyone. I'm Shanthi Hegde. I'm going into a public health program. I'm going to Brown, which I'm very excited about. But I am a advocate working in the intersection of rare diseases and also health equity. I live with two rare bleeding disorders and also an immune dysregulatory syndrome, which kind of brings that intersectional lens to my work. And I currently serve on the board of Hemophilia Federation of America, and I've previously served on the board for the National Bleeding Disorders Foundation. And I do a lot of advocacy in terms of just mental health access for individuals with rare disorders through the Bleeding Disorder Substance Use and Mental Health Coalition, doing advocacy work with Hemophilia Federation of America by advocating for affordable drug pricing for the rare disease community. And one of the biggest things I champion is education and research initiatives for women of color with bleeding disorders. And I also founded the first young adult bleeding disorders initiative in the world. And I expanded young adult representation in legislative advocacy and just policy discussions, making sure more young adults are represented in that area. And we ended up leading the inaugural Young Adult Summit in partnership with industry to just create a platform for education and advocacy. And so I'm really excited to be here. I hold a bachelor's of science degree in psychology and biology with a minor in history from Northeastern University.
I am just listening to you introduce yourself. You have a way of really energizing people. And I know it's not just me because I watched everyone's reaction to you in the room when we were in DC. I love your energy and I really appreciate how you are really leading from this place of your own personal challenge. And one of my favorite questions to ask my guests on these podcasts is this question for you, which is, when did you first learn about or become interested in public health?
Yeah, so it both stems from my personal history with having a rare disorder, but also with my undergraduate education. So I'll talk a little bit about my education first. I am a psychology major and a history minor. So at the time, I really wanted to go into medicine. I came into college saying, I am going to be a doctor. But being a patient in the healthcare system really just changed my perspective on things. I realized my passion wasn't just in treating people, but just understanding why so many can't even access that care in the first place. And it was also my struggle as a patient as well. So I just really saw the firsthand aspect of like insurance and cost and like socioeconomic status and also homelessness that's created because of inaccess to healthcare and the huge costs of getting access to healthcare. So I really wanted to work on these foundational problems. And I think I found solace in my history minor. And it just really taught me that unequal access to health isn't new. It's just built up over generations. And one of my major projects was that I researched the history of chronic pain, focusing specifically on pain that stemmed from disease and abuse on cotton plantations in the American South. In this project, I worked with a London-based public history group. They're called Global Threads, and they trace global connections of the system. And just I followed the cotton produced through human suffering on plantations like Cotton Point, and that cotton was shipped to mills in Manchester. And in this project, I saw so much suffering from historical abuses, and that just doesn't stay in history. that history is not linear. It's very cyclical, and really highlighting that true human cost behind economic growth of people that suffered really showed me how like health and lives were and sometimes still are treated as disposable in pursuit of profit. And so doing that work really just made me understand that public health isn't just about medicine or hospitals. It's also about understanding these systems of like past and present that really decide who gets care and who doesn't. It really made me see those systemic barriers today. For example, Black women still stemming from the transatlantic slave trade still don't get access to care for chronic pain. And that isn't seen as epigenetic for so many physicians. And I saw that we needed to change that in the healthcare system to recognize historical abuses as something to consider in terms of getting treatment to medicine. So I just saw that public health wasn't just something that is mainly tied to medicine, but it's about working to break down those barriers so that everyone has a chance to access healthcare. And that also started with learning about our past and how our past is incorporated in our present.
Yes. So many golden nuggets dropped in there just now. Completely agree with you. So, and that's a really, I love to hear that transition piece because everyone discovers and kind of gets into public health. It's a very different story and a very different route. But I really love that holistic sort of comprehensive pathway really that you just described. I think I know the answer, but I'm going to ask this next question. What population or condition or other public health problem are you most passionate about now?
Yeah. So as I mentioned before, I live with two rare conditions, actually three, including my immune dysregulatory syndrome. I live with von Willebrand's disease and factor VII deficiency, which are two rare bleeding disorders. And I became passionate about that through my own experience. And it really was a really just a path to get diagnosed. I got diagnosed at the age of 19, which is really late in life. You usually get diagnosed with bleeding disorders, especially since mine is congenital, it's genetic at birth. But for so many women, you don't get diagnosed until later in life because of access to care, access to testing, and also in physicians' minds, sometimes because I'm a woman, their initial thought is hemophilia and bleeding disorders. This just doesn't happen to girls. They just bleed. That's just because of their period. And I think that misconception stemming from like years of medicine being male dominated and periods just being considered to be normal is just something that bleeding has been normalized, even though it's excessive. And so I ended up through my entire middle school and high school experience was bleeding. I would have bruises. I would bleed. I actually ended up being on my period for like 8 to 9 months consecutively. And so my OB-GYN at the time, I grew up in Georgia. And so my OB-GYN at the time in Georgia was like, maybe you have endometriosis. You ended up getting the endometriosis surgery when I was 18. So my senior year of college or high school. And from that December of my senior year of high school to the end of my freshman year of May, I bled consecutively. I was at the point where I couldn't walk. I couldn't go places. I couldn't do things. I was just bleeding out. I was anemic at that point. And so I ended up being in Boston my freshman year of college at Northeastern, and I ended up going to seek care at an urgent care at an ER because I was bleeding so much that I couldn't see properly. And so I ended up getting an appointment with an OB-GYN. And for the first time in my life, I was asked, has anyone ever considered a bleeding disorder for you? And I was like, I'd never heard of this bleeding disorder in my life. I was like, oh my gosh, von Will what? I had no clue what this is. And so I finally got diagnosed July of 2022. And August, I ended up starting treatment. And the first thing that happened was I ended up having an allergic reaction to that treatment and ended up having to be EpiPenned. And that was the first treatment. And at that point, when I was trying to get insurance approval for the next treatment, through step therapy, which is a policy that is actually, if you don't have guardrails on it, it's quite dangerous for individuals to be taking generics, especially when And the bleeding disorder space, there are no generics. You need to be given factor therapy, which is basically a replacement therapy to replace the clotting proteins in your blood because I don't have enough of those. And so when I ended up going to get that therapy, I was hit with a $10,000 bill. And this was my sophomore year of college, and I thought I was going to have to drop out of school. And at that point, I had a doctor that was like, like maybe you get on Mass Health, maybe you get on, Medicaid, maybe you get on a different coverage plan, but it's not easy getting on those things. You have to have established residency. You have to wait for a certain period of time. That's when people fall through the cracks of you're choosing between trying to get insurance or trying to get access to this therapy that could be life-saving because you're bleeding out so much. So at that point, I was trying to figure out different options. And I just said, you know what, I'm going to have to take out a loan and I'm going to have to just get the therapy and continue. And that's what I ended up having to do. I ended up having to just take out a bunch of loans for school in order to cover my medical bills because insurance either covered it or partially covered or didn't cover it at all. And sometimes with insurance, you get hit with a copay accumulator or maximizer, which basically is saying, we're going to take your copay assistance card and actually you're still going to have to pay the $10,000 bill. And so that is very hard for patients like me who are also in school at the same time. So a lot of policy things that I had to go through that made people like me fall through the cracks. But I ended up getting access to medication, but I still had some physician hurdles. At the time, I was with a physician who didn't believe I needed treatment and or I needed consistent treatment. I was still having joint problems. I was still having bleeding problems. So I ended up switching my physician and finally got access to genetic testing, got access to getting more testing done. And this past September, actually, at the age of 21, I was diagnosed with factor VII deficiency as well after having a major elbow bleed. And so that journey is still happening. I'm still finally getting access to treatment. I finally recently got access to consistent treatment. I've been getting treatment through my port. I got a port put in, a port placed recently. So I'm finally getting access to some treatment, but it's still a journey because having two rare conditions, one being ultra rare, my factor VII deficiency is ultra rare, is not easy in terms of finding what treatment works best for you. There could be clotting issues. There could be issues of do these two treatments counteract each other? And so that has also been the biggest hurdle is, so what treatment do you get? And with factor VII deficiency, the actual factor VII treatments, there's only one treatment right now because factor VII, there's so little people who have it. So there's only one viable treatment right now that was made in the 80s. That the other treatment out there, it has the 7 in the name, but it is even indicated for factor VII deficiency. So there's just constantly a hurdle of having the rare disease and there not being enough treatment options out there. There not being enough people who listen, and also being a woman of color, I've literally been told like your bruises are just the color of your skin. They're not actually bruises. And so also the problem with, are women of color even represented in textbooks, in medical textbooks? And do people even know what bruises look like on women of color's skin? So there's just so much in my journey that I saw that. And using my journey, I want to be able to give back and really advocate for that community. And that's kind of also how I got involved in public health, through being an advocate in that area. That's also why I'm so passionate about bleeding disorders.
Yeah. Thank you for sharing. This is a very personal and vulnerable space, but I appreciate you sharing. And I, again, just, it energizes me and people around you to do the same, to definitely be supportive, but also it's such a tremendous lesson in being able to be a little bit vulnerable in this journey while you're on this journey, and then being able to help other people because you're not the only one. And, that's a great kind of energy and attitude there. What about, you mentioned your work on the board. Let's talk a bit about like your current role. I know you're very busy with advocacy work, and tell us a little bit more about what you're currently doing. And I guess I'd like to hear some successes. Like, how is it how are you starting to crack the ground and, get the attention of folks and make the change in the right direction that, you're pursuing?
Yeah. So I got on the board of Hemophilia Federation of America back in 2024 was actually my first year on the board. So this is my second year. And so as a board member, my primary responsibility is to represent the patient voice and really ensure that the priorities of our organization really just truly serve the rare disease community, particularly the bleeding disorders community. That really means like weighing in on some strategy, really kind of regrouping after we heard about the passing of the big beautiful bill, which unfortunately is very ugly for our community. It just really kind of reorganizing and regrouping and seeing how we can best support patient advocacy, how we can really work towards putting funds to design educational resources to make sure people have access. We also have a program called Helping Hands. How can we give back to, for example, people suffering with disaster relief, people in our community who have just gone through something like lost their job or are not getting access to SSI disability? How can we design funding for that to make sure that goes towards those community members? And also just making sure that, especially now in the political environment we are in, making sure that we're putting resources towards designing educational resources like how do you enroll in marketplace coverage? How do you look at new marketplace plans or marketplace subsidies? And also just making sure that as a lived experience expert myself, how am I using my experience to really highlight the real world impact that policy decisions are weighing in on patients and families, and how that has affected me, and how I can bring my story to make sure that we design things and we put in funding or we put in ideas to design things for the directors that work at HFA to make sure that they are able to put together something for community members. So really just planning and making sure that we are prepared for these upcoming few years or this upcoming year of what is happening with patients, what's happening in the current state of things. I think one of the biggest challenges I'll also talk about a success story is like really confronting just how inaccessible care still is for not only people in the bleeding disorders community, but for the rare disease community, even when there are treatments available, which isn't always the case, especially for conditions that are very rare, like, for example, factor VII deficiency or Glanzmann's thrombocythemia is another one. Affording them is just another battle. Marketplace insurance just can be extremely limited with high deductibles and formularies and also like out-of-pocket costs that really put life-saving medications like factor just out of reach. And also making sure that finding the right plans that exclude or restrict specialty drugs, which are really critical for rare conditions. So really working with our policy director, who is amazing, Mary Catherine, to make sure that we are putting all of that information, education information out there. I'm actually, as a board member, I am on the policy. I do a lot of policy work for them, and they have a legislative action button on the website, which we utilize and do regular policy action meetings within HFA. We do once a month meetings where we regroup and have community members who are legislative leaders in the community go to their community representatives and talk and chat with them about their story and how their story is being impacted by the current policy decisions. And so just kind of being a board member, being able to represent HFA in that area has been really amazing, especially mobilizing efforts in that area, given the current situation and the current environment, and being able to effectively do that storytelling and go back to the board and say, look, this is something that is really important currently. This is something that we should be investing in, and having that voice on the board of, look, I'm a lived experience expert and this is something that's important. We should be funding that, is something that I'm very much excited about and very much thrilled to have that voice. And then also making sure that we are really representing our constituents or our folks or members that are impacted by bleeding disorders and have that rare representation on the board, and also the young adult representation as well. But one of our biggest policy wins, I think, was this past 2024. There were two policy wins that I was absolutely thrilled about. One was our sponsor in the No Copay Accumulators Maximizers Act with our sponsor, Buddy Carter, who is on the other side of the aisle. Him really being our biggest champion in the rare disease space was an incredible thing to see, and also being able to talk about the bipartisanship to some of our representatives. I personally, at our legislative days, got to meet my representative in Georgia, who I don't always agree with, but it is really exciting to see that, that spark in their eyes when they say, oh my gosh, this is a bipartisan bill. This is a no nonsense bill. We should be able to sponsor this. We should be able to really make an effort to really help our community members that are going through some of these issues. And so I think that was really good, really great to see some of the bipartisan allyship between both Republicans and Democrats, both sides of the aisle, on some of these bills like no copay accumulators or maximizers, step therapy guardrails being one of them. And another win was through the Bleeding Disorder Substance Use and Mental Health Coalition. We actually had Kate Baczynski, who runs the Bleeding Disorder Substance Use and Mental Health Coalition, come talk to us in the 2023 legislative days we had. And that was still something that we've been championing. One of the things is the expansion of the 504 section in the 1973 Rehabilitation Act. And that basically says we need to really specify the language so that people with bleeding disorders and chronic health issues are not being denied from mental health treatment facilities. And so really putting together that Dear Colleague letter and really making sure that there is some specification. I believe that there have been specifications to that since, which is a huge win for the community, and be able to really tell our stories and how mental health really impacts us and have that effective storytelling as we did in PAI. We saw a lot of our amazing experts in the field talk about that communication and storytelling piece. And being a board member and really being able to guide individuals in the community. I was a group leader as a board member to take community members to the Hill and be able to guide people in that storytelling, be able to make sure that they feel comfortable enough to tell their story, and having a boot camp day of just effective communication was just so great to do as a board member, and then take some of those key highlights back to the board and say, look, this is what's really impacting our community, and really staying true to our roots. Our roots as Hemophilia Federation of America are the community, the advocacy, the patients, the education piece. HFA actually started out of the HIV/AIDS crisis, the blood contamination crisis, to be more patient-centric. So really staying true to our roots to be the voice of the patient is something that I've just really have been thrilled and enjoy seeing.
Yes, I love everything you're saying. And, we really, really heard that loudly at PAI, the importance of storytelling, humanizing the work. You mentioned this falls in a no nonsense category, advocating for people with chronic conditions, bleeding disorders, rare diseases. This is not it's not a Democratic or Republican issue. It's truly a bipartisan. It's just a human connecting on that human level. And these stories, sharing the stories, are extremely powerful because it does remind everyone of that human connection, how it's impacting individuals. And those individuals represent a collective group of people. That I thank you for sharing the wins. I think that we can easily get caught up in all of the work that needs to be done, and it's, like uphill battle. But sharing the wins is really refreshing. It's like, okay, we are making progress. We're moving forward. We're celebrating someone on the, other side who can really connect in this bipartisan way and say, oh, yes, we need to sponsor this. We need to get behind this.
Yeah, exactly. And I think so we have an upcoming Advocacy Hill Days in September with that. I think we have a lot to put our voices out for. And I think I think that's the most important thing, is having your voice out there. Even though one may think that having just one voice out there is like, oh, like they might not listen to me. It might not be a big deal, but to that person listening to your voice, whether it be on either side of the aisle, they are just always going to connect that story to the bill. We actually had the last legislative advocacy days, one of the legislators take the story to one of the hearings and say, look, I had a constituent come to me and share their story, and now they let me share their story with you today. And so making sure that your voice is heard, you're always going to be that person in the back of their head that they connect that bill to. So that's the importance of advocacy.
Yes, I'm so glad you said that because I was thinking of the same thing. I also moderated the panel where we had the state legislators. Like every last one of them said the same thing. Like connect with us. They want to know this. They want to hear your story because they know they're working for you. They're working for us. So if we arm them with those stories and they go into battle and they're able to bring those stories and share those stories, it makes such a huge difference. And so I'm glad you brought that up.
Yeah, yeah, yes, it absolutely does. And sometimes, especially in today's world, it might not feel like it, but I think in order to keep our spirits high and to keep moving, we have to keep advocating. We have to keep our voices out there, and we have to keep pushing for better.
Yeah. Well, really enjoying our conversation and I want to be mindful of time. So as we begin to wrap up, I will ask you, I have so many questions I want to ask you, but I'm gonna ask this one question because I think for people who are still listening to us right now, I'd love for them to have some action items. So do you have any tips for anyone who is listening and maybe they're thinking about wanting to step into advocacy or maybe whether it's supporting you or just really like how does somebody get started? What I hear often is, well, will it really matter what I can do? I don't think it'll make a difference. What advice do you have for someone?
Yeah, and to kind of tie this into a little bit with epidemiology a bit, when I talk about my bleeding disorder and it being so rare, people always ask me, like, what is that? Is it contagious sometimes? Just people don't know about it a lot. And it's also the question I get asked is, why should we care so much about something so few people have? And I think that question is exactly the problem. And when we think about it, just because something is rare doesn't mean it isn't important. I tell people, imagine being one of those few people having to fight for years to get diagnosed. Being a girl means not being able to get access to genetic testing at birth. Or imagine knowing there's a treatment that could save your life, but you can't afford it because your insurance won't cover it. Or there's no specialist in your entire state because the condition is so rare. But in epidemiology, we also talk about population health. And that means even if each rare disease affects only a small number of people. So, for example, there are over 7,000 rare diseases. Altogether, that's like 1 in 10 Americans having a rare disease. So that's millions of people affected by different rare diseases. And so it's not just some tiny problem. It's actually a very huge, scattered, and often invisible public health issue. So it's really about equity. And so I think stemming from that, one piece of advice I'd really like to give anyone wanting to do this work is just don't be afraid to tell your story and underestimate the power of one voice, kind of going back to the storytelling, even if you think that one voice is too small. And even if you think that one voice is very rare, because like effective advocacy depends on storytelling and your voice is just so powerful. It can move people on the other side of the aisle. And it can feel intimidating or even pointless sometimes, especially given the current state of affairs. It might even be demotivating. And we all wonder, does my voice really make an impact? But it does. And, it starts with just sharing your own journey. Even if you are a public health advocate, you're not personally impacted or you don't think you're personally impacted. Everyone is personally impacted. Everyone has a barrier that they have faced. And what you need is just really putting a human face on what otherwise just might be just an abstract policy or an abstract policy debate, just really making sure that there is a human behind that and that those barriers are real. For example, an environmental health specialist may think that they're not impacted by environmental health, but we actually are. For example, climate change is something that we are all impacted by, And for example, for me, I may not think that I'm impacted by climate change as somebody with a rare disease, but in fact, the heat actually makes me break out into hives. And I didn't even realize that, and how that is really just intertwined with climate change. So when you tell your story and help people understand why work matters and who it affects, you are making it harder for them to ignore. You're making it harder for them to just say it's just one voice. You are the voice. You are the voice. You're putting it out there and you are making a difference. So I really want to share that with people so they aren't discouraged by advocacy. They're actually really encouraged to put their voice out there. And I think another thing is to really stay connected to the real stories, your own and other people's. I always ask myself, why? Why public health? Why did I come to this space? And I think, one, it's my story of having a rare disease, but on the other side, it's the story of so many people before me who had endured the historical abuse and those who are still enduring the impacts of historical abuse and the violence surrounding that and their stories as well. I don't do this for myself, but I do this for all the people of color out there who have been enduring violence and abuse for so long. And so it's really easy to kind of get lost in that policy detail. But at the end of the day, this is work about people who are fighting to be seen and heard and really pushing that equity agenda, that this isn't just something that's, oh, everyone has equal access to care. They don't. This is an access to care issue. And we need, as public health practitioners, to make sure that everyone has access to that care. So making sure we're grounded in those stories, really listening to other people, patients, especially those who have barriers. And that kind of really keeps me grounded personally and makes that work really meaningful, is to listen to those stories and realize those barriers. And that motivates me to take action. So I think the last piece of advice I would leave people is don't be afraid to start small. Join a local patient group, attend a webinar. I actually started my own organization called Husky Hemophilia Group. It's a young adult organization. For a long time, I thought, that's something that is really meaningful to me. That's a voice out there that I don't see a lot of representation. And I would really love to see more young adult representation. And so I think that starting that, even if it was small, even if it had 3 people, and those 3 people were my closest friends and me, you're still making a difference. You're still putting your voice out there. And now we have over 100 members. That has grown. You don't even have to have a bleeding disorder to be in the organization. You just have to have a passion to learn and to strive in the area of making sure we advance research in health equity and education for all. And so it can start that small. And that's kind of how I first felt at the National Bleeding Disorders Foundation at HFA, attending policy days at HFA and starting my own organization. That's also why just making sure that people know who they are so we don't get lost in the cracks, and also that people know who you are, and also you're being your story out there. All of us have a story, and to make sure that is being told, and even if it's small, it's still making a big difference.
Thank you so much, Shanthi. This has been great. You've been very generous with all that you shared. I love the tips and definitely the connection back to epidemiology. I appreciate all of that. And what is the best way? Now, of course, we will have all of the links on our show notes page for those that are listening, but what's the best way for our listeners to connect with you?
The best way is actually my LinkedIn. I would love to welcome anybody that wants to speak, wants to chat about anything from rare diseases to my work in history and public health. I absolutely welcome people to connect with me, and I always welcome conversations and to share my story, to hear your story, to even chat about how we can advocate together, partner together to advocate.
Wonderful, wonderful. We'll make sure that we have all of that in the show notes. Thank you again. This has been fantastic. I encourage you to continue to do the amazing work that you're doing. And I look forward to continuing to be in touch with you and follow along your journey and all the amazing things that I know you're going to do and impact that you're going to have.
Thank you so much, Dr. Huntley, for having me, and for all the viewers for having me today. I am absolutely thrilled to be here, and I'm so thankful to be here as well.
I really hope you enjoyed that conversation as much as we did. I encourage you to connect with Shanthi and learn more about the work that she's doing. When you reach out to her, make sure that you let her know you heard her on this podcast. You can find the links to connect with her on the show notes page. The show notes page for this episode, which is episode 419, can be found at phecpodcast.com. Once you're there, just navigate to episode 419 to find its show notes. Now, one more thing before you go. Remember that our podcast has a new app where we can continue the conversations from episodes like this one with public health professionals around the world. You can download our new PHEC podcast community app in Apple or Google Play Store. You can also visit phecpodcastcommunity.com to join the community on desktop. All right, everyone. Until next time, have a fantastic rest of your day. Thank you for listening to the Public Health Epidemiology Conversations podcast. Visit phecpodcast.com to find the show notes for each episode and to learn how to work with me.